Coming up on this episode of the Healthy, Wealthy, and Wise podcast.
A lot of times it's your mom and dad or grandma and granddad. It is not your fault. Now, that doesn't say that you can't do things,
right,
but you didn't not necessarily create this. And so you aren't this kind of person or that kind of person.
Welcome to the Healthy, Wealthy, and Wise podcast with Dr. William T. Choctaw, MD, JD. This podcast will inform, educate, and motivate you to live a more healthy, wealthy, and wise life. It's powered by the over 50 years of medical experience of this Yale University Medical School trained surgeon, who also received his Juris Doctorate from Western State Law School. He has executive experience as a former mayor of Walnut, California, as a chairman of the nonprofit Servants Armed, and as president of Choctaw Medical Group Incorporated. You've got questions or concerns, he's got answers for both. So let's listen in on an interview already in progress.
Good morning, ladies and gentlemen. We're so happy to have you with us on this beautiful morning. We have a very unique and a very special guest with us, Mr. Sergio Zepeda. Sergio's a friend of mine. He and I actually work together in another organization where we both are members of the board of directors of this organization called Servants Arms, which is a community-based organization in Southern California. Sergio is actually vice chairman of that organization, vice chair of the board. And so I've worked with him for a number of years, and we were absolutely delighted when he was available and willing to come and spend some time with us. Good morning, Sergio.
Good morning. I'm very happy to be here and so glad you thought to invite me. I'm happy to participate. And gosh, it's been I was thinking how long it's been since we've been on. I think it's been 8 years.
Is there? Yeah.
Yeah. I mean, in a blink of an eye, it doesn't seem like that long.
No, it doesn't.
It's been about 8 years that I've been on the board. I know you've been on much longer.
No, actually, I think we all joined pretty close about the same time, or around about that time. Yeah. So from you and I have had some preliminary discussions, and from what I hear, you've had a lot of unique experiences, and that you were interested in sharing some of those experiences with us. So tell us about that.
So, let me tell you a little. Professionally, I am a human resources director. I work in public health. We are a public health advocacy organization statewide. We go into communities what are high risk or considered high risk, or more communities that have less resources, and we help them pass policies or laws at whatever level they want, depending on whether it be the county or the city, or we even do state legislation that promote public health. And I think a lot of, especially in underrepresented communities of color, don't know that you have the right to tell your city council, I want a green space. I want to limit the amount of fast food places that you guys keep being built. Why do you keep building so much? I think, especially people of color, I don't think they realize that there are these corporations that target us because we have this affinity for. I don't know if you've ever noticed that if you go into a fast food restaurant in a more well-to-do middle-class community versus in a community of color, the offerings of soda are vastly different. Sugar sweetened beverage, there's a huge monopoly of sodas available in the lower income communities, which are primarily communities of color. And in the basic middle class white community, there's Diet Coke, Sprite, and orange soda. But the communities that are impacted the most by the access to sugar to sweetened beverages are us. So we are trying to bring awareness to that. Some don't like it, but I like to be liberal and champion the cause and be a part of it all.
Good.
And also, I'm 50, 49. I found myself a dad of 3, a grandfather of 1, and I'd been focused on building this professional career, but the pandemic hit, no one left their house, and
yes,
my health spiraled. I didn't get COVID, but my health spiraled. I found myself about to turn 50, and I'm 6'4", I'm a tall guy, but I was 410 pounds.
Wow.
Been diabetic. My A1C was at 6.7. My triglycerides were 567. So I was like a time bomb, just, it was inevitable that it was just a matter of time that I was going to have some type of crisis. And I knew,
Understood.
I knew I had to reset, and I was especially prescient because I was 50. I'm about to be 50. I was like, I cannot enter 50 down this same path. So I was thinking about what I was going to do. I started dieting, working out, joined the gym, but I was so far gone that it was really difficult for me.
Yes.
It was painful, actually, just because I was so out of shape. I was so heavy. And I thought to myself, no, I need medical intervention, some help. So I looked into gastric bypass. And my insurance plan would have covered it. But they said you would have to participate in a treatment program for a year, lose 10% of your weight.
Yep.
There's no guarantee that you would be approved for the surgery at the end.
Yep.
And so I thought to myself, I don't want to wait a year. And so I paid out of pocket.
Okay.
And it has been... I think I was at a place where I had a lot of clarity about what I wanted, so it wasn't a difficult decision for me. However, I will say that there are many people who judged it as a poor decision, and I don't understand it.
Really?
Yeah, like, how could you take such a drastic measure and alter your body in this way so permanently? Aren't you afraid? Why are you doing it? Why don't you just exercise? Mostly they were people that are naturally thin, that naturally.
Right. Oh, yeah.
That never gained,
and they said, I don't understand your problem.
Never gained 5 pounds. They struggled to gain it. It's usually the skinny ones, they were. And so I got to a point where I just didn't I just stopped talking about it because I said, this is my decision. It's my path.
But Sergio, you bring up an important point. Let me jump real quick. And I gave a talk about a year ago because as a physician, as a general surgeon, and this type of surgery was not my specialty, but I assisted on a lot of cases because we help each other. So I'm very familiar with it. But one of the issues that I think our society doesn't appreciate is that obesity is more than just behavior. A lot of it is genetic.
Yes.
It is genetic. But yet in our culture, I'm talking about the U.S. culture, we sort of look this way at the person who's skinny, and the other person who's obese, and we make value judgments about them. We don't know them,
Absolutely.
But we just make value judgments about them. So one of the things I tried to say in the little podcast we did on this some time ago, a lot of times it's your mom and dad or grandma and granddad. It is not your fault. Now, that doesn't say that you can't do things,
right?
But you didn't not necessarily create this. And so you aren't this kind of person or that kind of person. But go ahead.
Predisposition, whether it be to diabetes, obesity, it's a very real thing.
Yes, it runs in families.
And it's a lot. People think it's not, but being healthy isn't inexpensive. You can try.
That's right.
But eating organically isn't inexpensive. You can grow your things, sure, but that's a lot of work. And if you're lower income, you probably work long hours or varied shifts. So it's when you have a 9-to-5 job, it's a little bit easier, right? Like you can make some time to garden or more flexibility in your work. But working class people, it's harder. And I think you're right, we're very quick to judge. And as I found myself judged by many people in this experience, which was very surprising to me. Mm-hmm. But nonetheless, I took the jump.
Okay.
And I did it. And I was actually very surprised at the recovery of it. So one of the most striking secondary effects of it, and no one told me this until the day of surgery, that my diabetes went into remission.
Yes.
Immediately following surgery. And I have had my diabetes in remission since surgery. I am processing glucose normal, but it never appears in any of the information because from what I understand, it's not a guaranteed side effect. Happens very often, but not always, and they still don't know for how long.
That's true.
Right?
It's not a guarantee, but I suspect that it's getting more and more and more like that because we physicians know other things that we can do to augment the surgery and that sort of thing to help patients to move in a proper direction. But a number of people do go in remission, and that's just great.
And what I don't understand, doctor,
yes,
is given the cost of diabetes treatment, the secondary effects that will come with poor mismanagement, that poor management of the condition, which is very common in people of color. We don't manage it well at all.
Yes.
Why isn't it offered more frequently as an option? I get that the surgery is, but it's a $10,000 surgery.
Yeah.
But
it's basically, this is just my own personal opinion. I think there are a number of reasons. One is that I think healthcare disparities do exist, meaning that I'm physician A, you come in as my patient, I look at you and just say I look at you and automatically I put you in a category. Psychologically, I put you in a category. And what I mean by that is we know, I've been in medicine for 50 years as a surgeon. We know that sometimes things are offered to one group, not always maliciously, but it may be, I know he can't afford blah, 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 so I'm going to do it this way, whatever. All sorts of discussions occur. And so a lot of times the opportunities or the remedy that's offered to the patient is limited. And patients don't know that. Patients aren't doctors. And you have to know to say, but, my friend did ABC. Why don't you tell me about that? And so a lot of that is intentional. A lot of it is unintentional, but it doesn't matter. It ends up not being in the best interest of the patient. So I tell my patients, I say, go in and ask a lot of questions. Go online, read stuff, write down those questions before you go in. If you're uncomfortable, take a friend who can ask them for you.
Absolutely. Yes.
But you're already at a disadvantage if you're in certain groups, be they financial, be they ethnic, et cetera, et cetera. And that's just a reality. Healthcare disparities exist, and it's real, and it's not in the best interest of the patient.
No, and even the profile, like I've had some people mention that, it upsets them that when their profile comes up on their doctor's medical screen, it says they're a Medi-Cal patient. And they receive different care. I've never been a Medi-Cal patient, but I have heard that many people that they experience this. Oh, then you don't qualify for this because of that.
Yes. Well, that's a part of that disparity where I get an attitude about you, and I may say that attitude doesn't affect how I treat you, but I have the attitude, so maybe subconsciously it does affect. You know what I mean? And I think that's why the whole issue of healthcare disparities is such a big deal, because there is a difference. There's a difference between men and women. I tell the story real quick. The way we used to treat patients with heart attacks, back in the 70s when I graduated from medical school, we were taught that a heart attack was crushing substernal chest pain. They radiated down to the left arm. Go ahead.
I was going to say, is it true that heart disease treatment is based on studying men, and so they
that's right. That's it. You know this. That's where I'm going. And so those studies that we were taught at Yale and other schools in the 70s were based on men, because men were the only ones in the clinical trials. Women weren't allowed to be in the clinical trials. So then what happens? We then come out with a distorted view of heart attack. Women may not have that crushing substernal chest pain that radiates to the left arm. They may come in complaining of dizziness or nausea or blah, 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 blah. So I think it's intentional and unintentional, but it exists that disparities end up causing some patients not to get the very best care they should get.
Thank you for listening to this episode of the Healthy, Wealthy, and Wise podcast with Dr. William T. Choctaw, MD, JD. We hope you now feel more equipped with tools and actionable information that will help you live a more healthy, which includes the mental, physical, and spiritual, wealthy, which includes the financial, health, and spiritual, and wise, which includes the practical, theoretical, and emotional life. For this one and past podcast episodes, blogs, books, and news you can use, go to www.thwwp.com. That's www.thwwp.com. And you've got it. In the meantime, remember, you too can be the change you want to see in the world. You've been listening to the Healthy, Wealthy, and Wise podcast with Dr. William T. Choctaw, MD, JD.